Hey guys, Jason Leon here with Robertson Wellness, and I'm going to get into 6 frequently asked questions about EBOO. So let's get started.
What are people using EBOO for in 2025?
Sure. So I have the luxury and a huge blessing of being able to travel from facility to facility, training on this device with practitioners from all different walks of life. I'd say the most popular indications now in 2025 are anywhere from like your long COVID patients to any type of chronic condition, meaning like, let's say, Lyme disease, Epstein-Barr, something like that, mold exposure, some those really hard to treat illnesses they're using EBOO for. I'd also say that there are some cancer facilities out there that are using EBOO as well. So it's a part of their protocol. And the very last one I would tell you is there's several high performance athlete centers that are using EBOO to help those guys go stronger, longer, harder, and recover quicker and get ready for the game.
How long does it take?
So this is a 50-minute procedure, 50, meaning the time we press play and set the ozone on and get all that, it's 50 minutes, but you'll actually be in the chair about an hour or so. I always joke around and say your car is going to be parked in the parking lot for about an hour and a half.
Please describe the procedure.
Sure. So we get two IVs started, which is really different from other normal IVs that you may have done in the past. So outside of dialysis, that's really the only other time we do this. But we're going to start two different IVs on the patient. We'll draw their blood from them. It's being combined with oxygen and ozone in this big diffuser. From there, once that process has happened, that oxygenated, ozonated blood goes through ultraviolet light and then back into another arm. So while they're sitting there, we're constantly drawing, oxygenating, ozonating, running their blood past ultraviolet light, and then back in them.
What does it feel like?
The procedure itself, there's plenty of people that get extremely calm. They feel sleepy. I've seen that happen oftentimes. We really, really encourage you to eat a high protein meal, solid protein, no protein shakes, because we can drop your blood sugar a little bit. But as far as, when the initial IV starts, it's pretty much just a hangout session with us here at the team.
How quickly will I feel results?
Yeah, that's a bit of a loaded question and $1 million question at that as well. I'd say that I've seen some patients experience results like a decrease in pain like the next morning. Others, it's a little bit more of a sneaky thing where they're maybe walking upstairs and their knee that's been hurting for many years now doesn't hurt, something like that. But the goal and what we're trying to do with EBOO is improve your mitochondrial function, reduce inflammation, and then balance out your immune system. So when we do those three things, there's all kinds of results that can happen from starting with those three base core fundamental things.
How do you get the machine ready from patient to patient?
It's a great question. So between patient to patients, we're constantly stripping this entire set down. There's a disposable set that we get ready and we prime with fluids and a little bit of an anticoagulant. But there's a new sterile set used for every single patient. I want to make a point that your blood never passes in the machine; it passes through tubing that's disposable. So that is part of the cost that goes into this. We're always having to tear these supplies out and put new supplies out for every patient.